Mr. Acting Speaker and honorable members, I rise today to announce that the Ministry of Health will be commencing the Steps to a Well Bermuda survey in October 2019. The survey is conducted in collaboration with the Pan American Health Organization, utilizing the standardized Pan American Health Organization and the World Health Organization's stepwise approach to chronic disease risk factor surveillance. This STEPS 2019 survey will update the information that was collected in the previous STEPS survey conducted in 2014. We anticipate the STEPS 2019 survey will enable us to update essential health information about our population. STEPS survey provide a sound evidence base on public health priorities for the prevention and control of chronic non-communicable diseases such as diabetes, cardiovascular disease, and certain cancers. STEPS surveys also track the direction and the magnitude of both risk and protective factors that influence the health of each of us in our population by exploring aspects of behavior such as diet, physical activity, alcohol consumption, tobacco use, and access to health care, including screenings. In STEPS 2019, the risk of violence and injury, including road traffic accidents, will also be assessed as it does remain a public health priority. All information collected aids in identifying where resources should be best targeted for and for monitoring and evaluating the impact of any initiatives, interventions, or actions implemented. The cooperation, Mr. Acting Speaker, of all in the community is essential to ensure that the vital health information is captured. A representative sample of Bermuda's adult population aged between 18 and 69 years of age is required out of the 2,195 households selected to be in the survey. We need all of those selected to complete the survey, and we need those that are not selected to encourage their family members that were selected, as well as their friends, etc., to participate. Participation, Mr. Acting Speaker, involves 3 steps, all of which can be done in the participant's home, and in its essence provides a free health screening for those selected. The steps in particular are as follows, Mr. Acting Speaker. Step 1, interviewers will use a questionnaire to assess the participants' health-related behaviors. Step 2, participants will have their blood pressure, weight, height, and waist circumference measured. And step 3, at a convenient time, a community health professional will take a fingerstick blood sample to measure fasting blood glucose and cholesterol levels. On completion of the steps 2 and 3, participants will receive the results of their measurements, which can be used personally and or shared with their healthcare provider, who can then decide on the most appropriate course of action given the results. All information provided to the trained data collectors is kept confidential and will be collected and anonymized. As stated previously, Mr. Acting Speaker, we at the Ministry of Health need the help of all of the community to ensure a successful STEPS 2019 to a Well Bermuda survey. As I stand here, I am sure that each of us can name someone that we know affected by a chronic non-communicable disease such as diabetes or cancer. I'm even more certain that each and one of us can name someone with chronic disease risk factors such as being overweight and obese, high blood pressure, insufficient physical activity, lack of fruits and vegetables in their diet, and or smoking. There is a saying within health that the risk factors of today are the diseases of tomorrow. Effective prevention and control of these diseases depends on access to accurate and reliable information about the prevalence and associated risk factors, and this information is obtained from the Steps to a Well Bermuda surveys. So I would like to encourage you to take steps to a Well Bermuda. If you are selected, say yes to the interviewer and participate to help Bermuda's overall health and your own. And those that are selected, I encourage you to encourage those selected to participate. A Well Bermuda depends on us all. Thank you, Mr. Acting Speaker.